Ma'am, I show you as Morgan Miles, Executive Director with the Texas Doula Association, or testifying on behalf of the Texas Doula Association, GALS, Maternal Health Equity Collaborative, and SELF for the bill. Is that correct?
Yes, I wear many hats.
Okay.
Thank you, Chair Frank. I'm excited to be here. I have other folks who I know are rushing up the stairs currently to testify on this bill. This is something that's really important to us. I am a doula, a practicing doula for the past 12 years. I've also been attending the MMRC meetings every time for the past 2 years. So I have been following really closely all the intricacies of how that committee works and operates. And I might be able to address some of the questions that y'all asked as well. So currently the best practices for maternal mortality review boards is to be able to review data, or to have the data within a year of the death, review it within the next year and present the following year. So the MMRC committee currently reviews deaths and then presents them to you guys every 2 years. This data, though, they get to choose which years are being picked to be reviewed. We know that the first time the report came out, the review was over the course of 4 to 5 years. It was like catching us up from 2013 to 2018. Following that, the next 2 years were presented, 2019 and 2020, or 2018, 2019. And then this is the situation that we're in now, is that the committee has decided that they need to be more contemporary on the data, and so they've decided to skip 2 years. So they're going to review 2021, they're skipping 2022 and 2023, and going to report, or they're reviewing 2020, skipping 2021, 2022, reviewing 2023, and that will be the next report. The issue with this, though, is that while the data is the same, the way that they collect the metrics, we're missing a huge swath of data. The last MMRC report that was released showed an increase in deaths across the board, but especially for Black women. And what we need to know is we need to be able to see the data from every single year to be able to understand how trends change over time and to be able to get recommendations on that. So what happened during those years? Well, we were still facing a pandemic. We were still facing, but it was, right, we were coming down from the pandemic in terms of opening things up. Okay, how did that impact maternal mortality and morbidity? How did other legislation impact maternal mortality and morbidity? We need to understand all of the factors at play so that we can make the recommendations and understand how to better, learn from our work. Additionally, the best practices that have been released around how to do maternal mortality and review committee boards is to have timely data, but to have all of the deaths that have been impacted by, that are caused by pregnancy or postpartum to be reported. And so this is one of the things that we really like this bill for, is because it is helping us to have access to the data.
Okay. Thank you very much. Members, any questions?
Yes, please.
And Chair recognizes Representative Johnson
Good
is
morning.
present.
Thank you. I am here.
And I believe you have a question.
Good morning.
Thank you. I apologize for missing the beginning of your testimony, but I did want to talk about missing those 2 years of data is pretty significant in our public policy making, especially given the changes that have occurred since the 87th legislature with regard to women's health.
Yes.
Would that be fair?
Yes, definitely.
So if we were trying to do a thoughtful analysis around the impact of the 87th session SB4, SB8, the trigger ban, that would cause a significant disruption in our analysis as to the impact on not only maternal mortality but morbidity, correct?
Right, yes.
So for example, if someone has a miscarriage and they have a rupture at 17 weeks, but there is still a heartbeat, then you would need to perform technically an abortion.
Right.
And most people don't think of that when we talk about abortion. People think of elective termination of an otherwise healthy pregnancy. And part of the reason we need the data is because we have seen a significant disruption in women's health care with regard to their reproductivity and your fertility in pregnancies that will either doom their life or doom their long-term health.
Right.
Is that fair?
Yeah, so what happens currently in statute, it says that the MMRC is not allowed to review deaths by termination, therapeutic or elective termination. And that is an issue. We know that that's an issue because it leaves out a huge swath of data that's vitally important. Additionally, what the MMRC board has decided this year is to bypass those 2 years of data. And those 2 years of data, as you said, are taking into impact what that legislation has done for our moms. We know that from ProPublica, an article released by them viewing discharge data from the claims data from Texas statewide, is that sepsis cases have increased dramatically. And those sepsis cases are deaths that we aren't going to have access to until the next report comes out, and not for those years. And those years are the ones that we're showing this huge increase in sepsis. Well, this is vitally important for doctors, nurses, obstetricians, doulas to understand and know what is happening and why, so that when we're in the room with the patient, we can say, this is an issue, this is your risk, and this is how, what the MMRC, what the state, mandated board says should be done in this situation.
And for example, what is the long-term health risk to a woman who is in sepsis at the point that she gets to sepsis while physicians are waiting to be able to perform healthcare, waiting on laws?
Yeah, so sepsis is something that can impact, one, it can cause death.
Yep.
But additionally, it can be, impacts to their health and well-being, physical health, mental health, and continuing to impact them years later. It also can impact their immune system, so that it makes them more likely to have other infections and things later on in their life.
And if we don't have this data, we can't, as policymakers, know that forcing a mom to go into a septic state, waiting on health care, actually has a significant impact on her ability to be a mom.
Right.
Long-term and just a healthy woman. And the cost of that morbidity, right?
Yes.
Is a long-term healthcare cost that not only drains the system. And so I'm so grateful for Chairman Wally and grateful that you are here to talk about, because I don't think any of us on this dais want that, and it's important that we have the data.
And
we got some bills coming up in public health that's going to be addressing some of this.
We do, and I'm so grateful for that.
Yeah, and just to be clear, the Maternal Mortality and Morbidity Review Committee has morbidity in it, but they're only reviewing mortalities. So some of the impacts of what you're talking about with morbidities aren't necessarily taken into account because that data isn't currently under investigation from the board. So this is really just understanding the deaths that have occurred, why they've occurred, and how we could prevent them in the future. And we know that 90% of deaths were preventable, which is ghastly and unacceptable, right? And so without that data, though, how would we know?
All right,
Thank
you
you
very
so
much.
much. Thank you, Chairman.